CataractCoach.com. I want to tell you about a book that I wish I had during my residency. So this is our book, Reflections of a Pupil by Dr. Rishi Gupta. And this book is amazing. If you are in your training, if you're a medical student, an intern, a resident, or fellow, you need the book, absolutely. And even if you're in the first few years of practice, it's still helpful. This book is not that long, a few hundred pages. The beauty is each chapter is about 2 or 3 pages, and each one is such a critically important pearl that's not normally taught, that you learn the hard way over the course of 10 or 20 years. Here it's all boiled down into one book. Like the title says, it's what your med school and ophthalmology textbooks can't teach you, but what your mentors, colleagues, and patients will. So I want to read you 2 little excerpts from this book. The first one is called Don't Fight Yourself. So surgery can be described as a pyramid with each step dependent on the one before it. How successful you are with one step influences how challenging the next step will be. Everything from draping properly at the beginning of the case to taking the speculum out at the end requires vigilance and care. Do yourself a favor and make sure you always address the basics. Get a good night's sleep, eat something before your day begins. Take the time to adjust the stretcher, the patient's head, the pedals, your chair, the microscope. Program your phaco settings. Giving your patient your absolute best effort requires that you be, at the very least, alert, well-fed, and comfortable. Don't ever come to the operating room unprepared. That's not good. It's bad for you and it's bad for the patient. So this chapter was fantastic, and that's such an important lesson. I won't read the rest of it to you. You'll see it in the book. Alrighty, and the second excerpt I want to read for you is this chapter. It says, the only way to never have surgical complications is to never operate. And that's absolutely true. I've told you before, there are 2 types of ophthalmologists who never have complications. Those who don't operate, and those who aren't quite fully truthful. If you do surgery, at some point, you're going to have a complication. You need to learn how to recognize it, react to it, and recover from it. Let's read you this. Accept it. Complications will happen. And if they haven't happened, you just haven't done enough cases. Operating can be stressful, especially when things are not going well. At times, it can feel like the walls are falling in on you. Your first posterior capsule rupture, performed alone as an attending, may be accompanied by feelings of panic, tachycardia, diaphoresis, and a sense of impending doom. You may look at your hand under the microscope and wonder why it's shaking so much. Slow down. Take a deep breath. Calm down. Believe in yourself. You can do this. And in fact, for the patient's best interest, it's important that you do what's best for the patient. So these are, again, critically important lessons. He goes on in this chapter to explain in a lot more detail of what it means to have a complication and to learn from it and to improve your skills by doing that. So I really want to highly recommend this book by Dr. Gupta. It's fantastic. It's things I wish I had known 20 years ago when I did my training. You absolutely owe it yourself to buy it. I have no financial interest in this book, but I'm a huge fan. Thanks, Dr. Gupta, for a fantastic resource for all ophthalmologists, young and old.